Hello, I'm Dr. Craig Jonov, otherwise known as Dr. J. So in consultations today, we had numbers of patients, and the question that seems to always come up is when patients are kind of inquiring about having a breast augmentation, they want to know whether they need to have just a primary breast augmentation or do they actually require a lift. The number one thing is you have to assess where the nipple position is. And the first situation is, it's going to roughly set midway between where the crease of your elbow and the crease of your underarm is, and usually above the level of the fold of the breast, the inframammary fold. So when you start looking at that, that's kind of the part that sets things in play of whether you're going to end up having to lift the breast to the appropriate position, because the center of that is where the implant goes. So if there's a little bit of asymmetry, if one nipple's further down than the other, it may require a different technique or a different type of lift just to balance them or to make them equal. We then look at, okay, if the nipple's above the fold and it looks kind of decent, what is the amount of tissue from the nipple to the fold? So that would give us a guesstimate of how much volume it's going to take to fill up the deflation of that breast. If we can do that with a size that works in conjunction with the shape and contours of the body, we can do a primary augmentation without the lift. And sometimes we can actually do it partially under the muscle and partially under the gland, called a dual plane placement. So it takes advantage of a little bit of extra space or tissues that the volume can fill out that envelope, so you don't have to really go through a formal lift. But outside of that, we then would unfortunately have to lift the nipple to the right spot, centered into the breast, so when the implant is, there's the appropriate amount of space that goes to the cleavage side as well to the side part of the breast to give you some side projection or side boob. We also look at the bra roll. If there's too much volume, it may make the implant have to be really big. So sometimes we can contour that to make a better shape of the breast. And so the whole goal of lifting it is to give redundant or maybe stretched out tissue the opportunity to be removed and give you a nice contour around the base of the breast to give you that natural breast look. So sometimes you have to do the lift, a lot of times you don't. You have multiple factors. To rephrase, first thing is nipple position. Is it in the appropriate space? Are they symmetrical? And the distances between the nipple and fold, as well as the notch to nipple distance and the relationship to the rest of the body. Hopefully that helps. Hope to talk to you soon.